Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator here with the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm doing great. Thank you, Katie.
Dr. Murphy is the executive director of the Havey Institute for Global Health, as well as the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week here on the Havey Institute's Facebook page. Today, Dr. Murphy will be addressing the latest headlines as well as answering viewer-submitted questions through today, October 12th. We invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with the US COVID statistics from this week, average new hospitalizations are at 2,591 per day. Average COVID deaths per day are 87.8, and the new vaccine uptake that we're seeing from this new round of 2023 vaccines in the first week, September 15th through 21st, there were 4.4 million Americans that received the COVID vaccine. Dr. Murphy, your reactions to these numbers?
Well, the new hospitalizations per day is slightly down, about 6%, 2,500. This is across the whole United States and territories. So that's good. It looks like it's kind of flattening out because we haven't really gotten to the peak of what we expect the epidemics to be, would be like December, January, February. So we'll see, but that's a good sign. And deaths per day, which of course occur many weeks or even months after somebody's infected, also stable at 87, 88K people dying per day. Terrible, but I mean, it's been much worse. Remember that the average flu death per day is about 100, but they're skewed toward the winter and early spring months, late fall. So it's not even, whereas COVID is a little bit more even. But so we're in the same ballpark as flu. And the fact that over 4 million Americans got the new vaccine in its first week of availability is, I think, an encouraging sign. People are out there getting it. The ones that really want the vaccine, of course, they're going to run and get it. And because they know it works. This vaccine is specifically geared towards what's floating around now. So it's actually a totally new vaccine and new design altogether. It doesn't have any of the old parts in it, which don't work very well anyway now. So that's a good sign. I hope that keeps up.
Absolutely. And moving on into our submitted questions for the week. The first one is for someone who is working on through a personal decision. They visit nursing homes as they help transport a disabled adult to medical appointments. The person who is working is 65 years old and has certain pre-existing conditions and has had cancer in their history. They're nervous about, interacting with nursing facilities as there have been a lot of COVID outbreaks there. Can you give your general opinion and any advice or reasonable steps to take to protect themselves?
Yeah, this person is very high risk for getting a variety of diseases that can be in nursing homes because the nursing home patients are very high risk. It's going to be impossible at any one particular instance of time to know exactly what that risk is, but it's high. And this person is a high risk individual. So when they're in the nursing home facility, they should be wearing a very good mask. I would say this is a time where using one of those N95 masks would be really the most appropriate.
Mm-hmm. Absolutely. And our next question comes from someone who recently has COVID as well as their spouse, and they would like to know when they can get the updated vaccine. How long should they wait?
This is a very common question. I get this question maybe every day. There's a range of time. So first of all, you want to feel completely well before you get this new vaccine, new COVID vaccine. But a lot of people are waiting longer because you've just been exposed, you've got a pretty vigorous immune response going on from the disease itself. And the recommendation is you can wait up to 90 days. I typically tell people to wait 2 to 3 months. And so this fits right in with the guidelines. So there's no big rush after you've had it. So it's that clock, that 90-day clock starts at the time you had the infection. So you can go 2 to 3 months from then.
And can you remind us of your general COVID vaccine recommendations, as well as let us know, are the side effects from the new vaccines similar to the old ones?
Yes, there's really been no significant difference between the vaccine side effects. It's mostly just pain at the injection site, not even really pain, but soreness. And then in the 24 hours after you have the vaccine, you can feel a little achy, you can, feel a little punk, but that does go away pretty quickly in like a day or so. Same as before.
Mm-hmm. And moving into our headlines for this week, there was a very interesting group of studies that were published and were around the studies studying vertical transmission of COVID-specific antibodies, specifically in pregnant women. Can you let us know about these findings?
Yeah, so there's been a lot of studies in pregnant women getting the vaccine, protecting them during pregnancy. And it showed that no matter when you gave the vaccine, first, second, or third trimester, these women were protected from getting COVID, because getting COVID while you're pregnant can be dangerous. That's just related to the pregnancy. So this study is looking at, it was looking at the bivalent booster. This is the booster from last year. It was published, and they show that the benefits for the COVID vaccine were present during the second and third trimesters. And they looked at these women, and they looked at the blood samples and found that the ones that were vaccinated in the third trimester, the end of the pregnancy, had much higher antibody levels to COVID. So that does translate to a better effect. And they also found that the babies, those antibodies are passed on to the babies. And so they suggest for optimal vertical transmission of COVID antibodies, in other words, passing it down to the baby, expected mothers, if possible, should get vaccinated in the third trimester, because it'll look like just a little bit more effective. And so this is also the same thing as approved for RSV vaccine. So RSV vaccine is now approved for women, for people 60 years of age and older, because it's really an older crowd, and those with underlying diseases at risk for RSV. RSV is not like COVID or flu, which can affect, really seriously affect everybody. But RSV vaccine in pregnant women is very effective in protecting their children, because the other risk group are the newborns, new kids under, kids just after they're born, up to like 6 months or so, are at risk for RSV. So that's just another way to protect the baby if you vaccinate the mother.
Absolutely. And while not my area of expertise, I understand that for many vaccinations, newborns have to wait, a certain amount of time, a certain number of months to receive those. So this seems like in the interim is offering a good amount of protection in a very positive note.
No, it really does. Those babies can take the monoclonal antibody if they're at risk for RSV. So that's another treatment that's available for babies.
Mm-hmm. Our next story comes from Moderna. It is their early clinical trial results from their combination flu COVID vaccine. Can you tell us a little bit about their announcement?
Yeah, since looks like we're going to be recommending flu and COVID vaccines at the same time, they put them together in one little package. Now, it's not on the market yet. Matter of fact, in the preliminary studies that they've done, it shows like it's safe, it's effective, and it works. It might even be better than giving the two vaccines separately. We'll see. But they had called this thing the mRNA 1083 vaccine, safe, tolerable, and everything. But the studies are ongoing, and this is not going to be ready until next season. So a year from now at the earliest.
Well, still very good news coming out of those preliminary trials, but some more dour news from recently published research was that in older adults that RSV was now more severe in terms of severe infection when compared to COVID and flu. Can you tell us about those findings?
Yeah, this is just a good clinical question. Like, how are these three viral infections that cause pneumonia, RSV, COVID, and flu? What's worse to get? And you have these three studies published just in the past week. And they found, when they look at the epidemiologists, look at this, they found that RSV was the most severe. If you get sick from RSV, that's worse than having COVID or flu. And they did all these calculations about the odds, like what percentage is more sick, and who ends up in the hospital, who ends up on a ventilator, who dies. And RSV is the worst. COVID is second worst, and flu is just bad. So if you just put them, if you want to rank them, it's RSV, COVID, and flu.
Absolutely. And these studies just underlie the importance of these vaccinations that are now available to the public. So remember to keep an eye out for those RSV vaccines, COVID and flu as well, if you have not already.
Right. That's why all three of those vaccines are approved now and being encouraged by public health authorities for the people at risk. Now, remember, flu and COVID is recommended for everybody 6 months of age and older. RSV only for a pregnant woman who wants to protect her child. That's a different story. But for anybody 60 years of age and older. Now, you can make some adjustment on that based on underlying disease, or if they have an organ transplant or something like that. But that's why pushing so hard for these vaccines.
Yes, absolutely. And our final story for today takes us on a global scale. WHO scientists and officials have been warning that dengue will take off in broader areas of, the globe. Can you tell us about these announcemements?
Well, a lot of Americans have not really heard of dengue unless they've been to the Caribbean or places in Central America or Africa or Asia, warmer places on the earth. But as the climate is changing, this warmer weather conditions is perfect for the spread of the mosquito that carries dengue. So what's the WHO, the World Health Organization, predicts is that Southern Europe and the Southern United States and even more regions in Africa and the Americas will become dengue areas. There's no reason why that's not going to happen. And so dengue, there's over 4 million cases per year and about 20,000 deaths per year. But as the region that dengue is being spread, if something isn't done about it, those numbers are going to increase. It can be a very severe disease. Similar to malaria, oftentimes it gets mixed up with malaria because the symptoms are about the same. And the muscle spasms and joint pain are so severe, it's often referred to colloquial as break bone fever. I mean, they're just everybody's shaking so much that they feel like they're going to break their bones. They don't actually break their bones, but that's the nickname for it, or the colloquial expression. This year, Bangladesh, the country, was the worst hit by dengue. It's a very populous country in Asia. They had over 1,000 deaths reported just from dengue. So, of the 20,000, 1,000 were in Bangladesh, one country. So dengue is coming. So right now, there's no treatment for it. There's no vaccines for it yet. And there's a lot of work that really needs to be done, more with dengue, and it's being done.
Yes. And on that note, thank you, Dr. Murphy, for your expertise, both reacting to the COVID statistics, answering our viewer submitted questions, and to these headlines. We really appreciate your time and, again, your expertise.
Well, thank you, Katie.
And thank you all for watching. We really enjoy having you come back week after week and responding to your questions. If you have questions revolving around any of the stories we talked about or general COVID, infectious disease, or public health questions, please feel free to submit them down below or at any of the linked places where you can reach us in the description. Thank you and have a great day.
Have a good day.